Doctor, this is a wonderful gentleman. We've done LaZrPlastique surgery and now he has flown back to us for his second stage in this particular case of real keratotomy, where he has so much ectasia and scarring that we actually planned for an outcome with LaZrPlastique to then use that as an algorithm for LaZrPlastique to come down on this cornea, correct the scar and the ectasia area. And we are being very finicky. We just marked the 180 axis. Right on. How do you feel, Rob?
Wonderful.
Yes? Excited? Ready to roll?
Very excited. Looking forward to the result.
You can see the irregular reflex with the Purkinje image of the lens inside the eye. And we'll be working on this with LaZrPlastique. This is the ectatic area with real keratotomy cuts all over. See in this area, a very ectatic area with very dense elevation between the concave cuts. And we're going to work on that with LaZrPlastique. Excellent. Now we just finished doing LaZrPlastique on your real keratotomy and corneal scar with ectasia. Can you tell any difference?
Absolutely no difference. Looking at the light, it's very sharp.
Fantastic. Any pain at all?
No pain at all.
Super. The doctor's watching. If you can see out there, we showed you the reflex before surgery, and here it is immediately after LaZrPlastique, a perfect circle of sight. You can see behind that the Purkinje image of the premium lens we have done for him. This is a bulge and the scar between his arcade right here. And yet we have been able to do LaZrPlastique, and now months later he has traveled back and we are doing LaZrPlastique on his cornea, straight to vision. Anything you want to say, Robert?
Extremely comfortable, very professional. It's been a very positive experience.
It's been my pleasure. Congratulations. Safe travels back. Wonderful. Here is the professor himself.
Hi, Kelly.
Yeah.
You've never looked better.
You can see it, right?
40 years you've never looked better.
Okay.
How do you
Can
feel?
read this?
Yes?
I feel comfortable.
Yes? Did I keep my promise? No pain?
Absolutely.
Yes.
Oh, there was no pain.
Absolutely.
Listening to everything you said
Yes?
during the procedure.
Yes, very important, because teaching, I love to keep talking, explaining, and I love for you to talk impromptu too, because I'm letting doctors see many things here.
Yeah.
None of you are ordinary people. Where have you traveled from?
Virginia.
So quickly, doctor, for his history. Among the real keratotomy cataracts that I do patients through 30 cuts, 40 cuts, no stitches, right? All of yours. There are some cases where they are totally off track, no measurements, because not only did he have RK, real keratotomy, he had scars and a complete bulge in his cornea. Impossible to know what the measurements are. Yet we did a very successful LaZrPlastique, went into his eye, removed his cataract, no stitch, right?
Correct.
And waited for him to become measurable and stable. And then he's flown back for my planned stage 2. Where actually in my LaZrPlastique, I planned for a certain outcome, and then I used that algorithm with the laser to hit the real keratotomy cornea and ectasia refractively. And the immediate result, how long was the surgery?
It seemed like it was only about 15 minutes or so.
Even less. I was working.
Was it less?
So total laser time was about 2 minutes, doctors.
2 minutes?
And he's out of the laser suite right now. How do you feel?
I feel comfortable. I feel good. My vision is amazing.
And doctors, he still has a real keratotomy cornea. And as I keep teaching you all, none of my patients are ordinary people who come across the street. How many years have you stalked me? Stalked, I say, doctor, because no longer do they follow me. They watch my work for years,
I've
right?
been stalking you 5 to 6 years.
5 to 6 years.
Sure.
Ain't that amazing? Ain't that? And today you are part of this system. How do you feel?
I feel great. It's almost like a miracle, actually. It's very emotional.
Be amazing. Stay amazing in your case, right? Okay, Kelly, look after this amazing guy.
I will.
All right? Get
Well,
some rest in the
thank
hotel.
him real quick, but
Sure.
he ran away.
Okay, all right. Where is he? Sir? I'll see you guys. Take care. Congratulations.
My name is Robert Morris. I'm here at the Gulani Vision Institute. This is one day post stage 2 surgery. I'm feeling completely comfortable this morning. No pain in my eye, and I have supervision in my treated eye, right eye. I came to learn about Dr. Gulani after doing extensive research. My eye history is radial keratotomy in 1994 with an outstanding result. In 2010 and 11, I had PRK surgery in both my eyes to improve some degradation that had occurred in my vision. And in about 2017 time frame, I was again experiencing some loss of focus, loss of sharpness, and I started doing research, and I came to learn about RK patients, long-term, some loss of vision, RK drift, and then I started doing research about doctors and came to learn about Dr. Gulani, and that was in the 2017-2018 time frame. I realized what a complicated eye situation that I had, and I spent a number of years thinking about and contemplating initiating contact with Dr. Gulani. In 2023, I initiated that contact, came down to Jacksonville from Virginia, where we live, and had extensive conversations, one-on-one conversations with Dr. Gulani. He spent extensive time with me as a patient. He went through all the risks, indicated that I would possibly be looking at 2 stages for my procedures. The first one was LaZrPlastique surgery, and in the healing period, I became a bit concerned, especially after the first 2 weeks. I didn't notice the healing process improving my vision as I had experience with PRK and RK surgeries. And I became increasingly concerned. My vision was not as good as it had been prior to the surgery. I was a little bit anxious, but I also knew that I had done extensive research, that I had gone through the procedures that I would be doing with Dr. Gulani. And so I had a bit of a tension between anxiousness of my immediate situation but the confidence and kind of the intellectual understanding that I had a journey, and I was still in the middle of that journey. So I was eager to have the second procedure, and here I am on the day following surgery, and I couldn't be happier with the result.